I would like to move on to our next speaker, who is Catherine Jenkins, who is the Vice President of the EUPHA Health Literacy section, who is one of the co-organizers also of this event. And Catherine is lecturer at the London South Bank University in the United Kingdom. And you will talk about building capacities of non-formal learning providers to promote health literacy across the life course. Catherine, over to you.
Thank you so much. I will just share my screen. So yes, I will be talking about building the capacities of non-formal learning providers. And as Didier has already mentioned, so I'm building on his talk, which is great. So I just wanted to start off briefly with a few definitions. So they're both quite long, but I won't go into them too deeply. I just wanted to show the most current ones. So health literacy. Today, I'm defining it as an asset which works across generations, so very relevant for this particular focus of this webinar, but it's also something that's mediated by different organizational structures and the resources that they've got access to. And it enables people to access, understand, critically appraise, and then actually use information and services for health. I'll also be talking a little bit about the health literacy of organizations, and part of that is health literacy responsiveness. So this is the extent to which an organization can respond to the health literacy strengths, needs, and preferences of the people that the organization interacts with, including its own staff, to create enabling environments or supportive environments that optimize equitable access to health, not only for individuals, but also for their families and for communities as well. So why non-formal learning providers? So Didier kindly already sort of went through the definitions of formal, informal, and non-formal, but I just thought I would touch upon them briefly as well to kind of explain why I chose to focus on this one in particular. So the white paper, which I've put a reference to at the bottom there, they talked about locations of learning, and within that, they talked about non-formal learning providers. So non-formal learning providers are organized, often community-based organizations that are trusted, where they are providing learning that is not the core business of the setting. So unlike formal learning providers like schools, where education is their main mission, their core business, non-formal learning providers are usually doing something else, and then they also do learning as well, but it's not their main thing. And then on the other side, informal settings, they are more spontaneous, unstructured learning that is part of everyday life. But I think that there is great potential in the non-formal learning providers. And I've just got two quotes here, which come from the Locations of Learning paper. One is from a community-based setting, and one is from a prison. And I think that we can see in those quotes the power of non-formal learning providers that enable people to access education and learning about health that they wouldn't ordinarily think of as being part of that setting where they find themselves. So the first example is just a community centre. And the learning that happens there is very organic, but it is also organised, and it's something that is being offered as a benefit through that organisation. And the learning that happens in prisons also, education is not the prison's main focus, but it is a very important part of what they do, and it is accessible to prisoners during incarceration. So that's just two examples. I really also wanted now to map settings where health literacy and health learning can happen across the life course. I really like this particular diagram, which takes us from cradle to grave, but I also really like the one that Didier just showed, because it also went further, you know, from preconception and fetal life right through to end-of-life care as well. And again, I think there are other settings that you could also map onto here in addition. Some already mentioned today, so faith-based settings such as churches or mosques, prisons, and then also social media as well. And I've just popped a few more links there to different papers which have different diagrams where they map settings onto the life course, because I think it's really useful and generative to think about the different ways that we can conceptualize this. But I do particularly like this diagram. So this is the main focus of the presentation. It was a bit, how do I say, like a little bit of preamble, but this is really what I would like to tell you about today. So this is a model showing different settings working together, and many of the settings in the middle of that model are non-formal learning providers, and they are all working together as a supersetting approach. Now, if we look at the middle of this model, yes, we've got some formal learning providers. We have kindergarten, we have school, but then we also have these non-formal settings. We have the public library, the museum, the sports club, the supermarket. And what this model is showing, it was developed in Scandinavia. It is showing what they called a supersetting approach, because in public health, there's already this concept of a setting approach, which is using the assets of settings to promote health. But this is like a settings approach 2.0, so it's like turbocharged. And it's more than just a multi-setting approach. It's actually multiple settings working together in ways that produce something bigger than the sum of their parts. So they are part of a coordinated effort. And it can't be implemented top down by councils or by city planners or by academics. It really has to come from the ground up, from the local stakeholders working in those settings. So from public library staff members, from youth workers working in the sports club. And it is underpinned by 5 principles there on the edge. So integration, participation, empowerment, context, and knowledge. And then it's also open-ended. So it can work with other partners. And these partners might not be non-formal learning providers, and they might not be involved in health at all. But they will very much be working closely with the supersetting to make it stronger. And they include things like the public sector, the media, and civil society. And I know that this can all sound quite abstract, so I also wanted to include an example of this in the real world, in practice. And such an example is Tingbjerg Changing Diabetes. So this is a project that operated as part of the city's Changing Diabetes project, which is now Cities for Better Health, and they went into the neighborhood of Tingbjerg, which is quite a deprived neighborhood, and they organized lots of different settings working together to improve community health. So if you're interested in how a supersetting approach looks in practice, then I would really recommend looking up the Tingbjerg work. It's super interesting and very inspiring for how we could involve settings working together rather than working in silos separate from each other. And then I just wanted to zoom in on one of the settings that was in the center of the supersetting model, the library, the public library in particular. So there's already been a recognition internationally that public libraries have great potential and do already do a lot of work to promote community health. They are open access, they are very accessible to old and young. You can get a library card as soon as you're born in some places. And it's also a place where you don't have to spend money to spend time there. And you can also access lots of reliable, good quality health information there too. So they have great potential for health education and health literacy. This is a model of a public library. It's actually quite old. It's from 2012, but I like it because it shows the different overlapping spaces. So the public library, not just is somewhere where you go to do one thing, but it's where you go to do lots of things, including health. And then building on this, a more recent model has suggested 5 principles for a health literate, multi-purpose public library. And these, when I say them, you're going to think they sound exactly like the supersetting principles because they're very similar, which I like. It's this, building on previous learning and synergy. So the 5 principles are empowerment, equity, inclusivity, collaboration, and integration. And if we just look back at these principles as part of the supersetting approach, there's a lot of similarities there. And I think the public library is, again, a nice example of that supersetting approach in practice, because the public library is a non-formal learning provider, and as a health literacy responsive organisation, works a lot with other organisations. It doesn't do this work by itself. It works with formal learning providers such as schools. So school children will often have visits to their local public library, but it'll also work with social workers, community organisations, youth clubs. So there's already lots of work going on in the library that we can take forward, I think, in other settings. There's also lots of work going on in sports clubs that we can learn from as well. So that brings me to the end. I just want to say thank you, and a little bit of recommended reading is the IUHPE, International Union for Health Promotion and Education Global Working Group on Health Literacy, has published just last year a position statement on health literacy, a practical vision for a health literate world. And I really like the fact that they've highlighted it's practical and not too academic. So thank you very much for listening.